Hey everyone, I'm Dr. Forrest with Allen Spine and Sport. I'm going to talk about what joint centration is. So this is sort of a topic that we talk about a lot within DNS or dynamic neuromuscular stabilization, which I've done previous content on. So joint centration means that we're using the correct muscles around all our most important joints, starting with the core and the spine, but then also the shoulder complex, the hip complex. Because typically what happens is we have two sets of muscles, phasic and tonic, and the tonic muscles are the ones that are tight, easy to remember, tonic tight, and they create undue stress on the joints by micro movements in the joints when we're going through our everyday activities. And basically what happens is when a bone is in a joint and half the muscles are kind of tight and overworked and half of them are weak, it creates a dysfunctional movement in that joint where certain parts of the joint can kind of pinch on each other, can create micro tears when done repetitively. Inflammation obviously results in pain. So what we do with our DNS movements and exercises that I've previously talked about is we take the tension out of those tonic muscles by activating or strengthening the phasic muscles, which is really difficult to do on your own. So it takes a practitioner to kind of like teach you how to go through these movements and feel the activity in those muscle groups. And so when we go through those movements after some DNS therapy, that we have correct muscle activation of those phasic muscles or the small intrinsic like deep muscles of each joint, then we move that joint and it's not pinching, creating inflammation in a dysfunctional pattern. So that's why DNS is so beneficial and so effective, is because we can improve joint centration by activating those phasic muscles. So again, I'm Dr. Forrest with Allen Spine and Sport. Thank you for watching, and pay attention to more content on other therapies that we do and so on and so forth.